People may mistake hypervigilance for paranoia, as a person experiencing hypervigilance may exhibit some behavior that seems paranoid. However, there are differences between these conditions. Understanding hypervigilance can enable people to access the right sort of help and better manage their symptoms. People with hypervigilance often feel there is a threat close by. When someone experiences hypervigilance, their subconscious is constantly anticipating danger. As a result, their senses are on high alert, ready to spot and respond to any danger. The situations they are trying to spot might be a physical danger, a repeat of a traumatic event, something wrong in a relationship. This superior alertness makes people with hypervigilance feel and act as though there is always a threat around the corner. Normally, they are not responding to a real threat. Rather, their brain is overanalyzing and overreacting to input from their senses. Hypervigilance can be a symptom of post-traumatic stress disorder, PTSD, anxiety, or other mental health conditions. The way people behave when they are experiencing hypervigilance can seem similar to paranoia. However, there are important differences between the two mental states. In paranoia, people hold specific, untrue beliefs that certain people or things are out to get them. People experiencing hypervigilance don't have any fixed beliefs about a specific thing happening. However, they are not delusional but just on high alert. In paranoia, people have a delusional belief that someone or something is trying to harm them now, in the present. In hypervigilance, people are on guard in anticipation of something bad happening in the future. In paranoia, people will not be aware that they are suffering from an illness and may believe that their delusions are true. In hypervigilance, people often have an awareness that there is no objective reason to be on edge, but find it hard to relax. When a person experiences hypervigilance, their behavior can vary widely. However, there are some common types of behavior that often occur. People experiencing hypervigilance may keep checking their surroundings and find it hard to focus on conversations, be easily startled and jump or scream at things they hear or see suddenly, overreact to things happening around them in a way that may seem hostile, find crowded or noisy environments overwhelming, look closely at people to see if they are holding weapons, overanalyze situations and believe them to be worse than they are, overestimate the chances of a bad thing happening to them physically or in their relationships, be overly sensitive to people's tone or expressions, taking them personally, have trouble getting to sleep or stay asleep. Due to the way hypervigilance may cause people to behave, there can be long-term complications. These include obsessive behavior patterns, physical and mental exhaustion, difficulty in relationships, problems in the workplace, avoidance of social situations. Hypervigilance is the brain's way of protecting the body from danger. As such, people fighting in the military or experiencing violence at home may exhibit hypervigilance with good reason. However, hypervigilance can also happen when there is not a real physical danger. When this happens, it is as a result of a mental health condition. A 2009 study conducted on rats found that a hypervigilant state made them more vulnerable to anxiety. More research is needed to understand hypervigilance is a symptom or a cause of anxiety disorders. Hypervigilance may also occur in people with other mental health conditions. These may include schizophrenia, obsessive compulsive disorder, bipolar disorder, The first step in treatment if a person experiences hypervigilance due to domestic violence or military combat is to remove them from the dangerous environment. When someone experiences hypervigilance due to a mental health condition, other treatments that may help include therapy and medication. A doctor may refer people for therapy to help treat the mental health condition that is causing their hypervigilance. Therapies that may help include cognitive behavioral therapy for anxiety or exposure therapy for PTSD. Anxiety and PTSD can be treated with beta blockers, antidepressant, or anti-anxiety medication. Schizophrenia or bipolar may be treated with antipsychotics. Incorporating exercise into a daily routine can be a powerful strategy for managing hypervigilance and improving overall mental health. Regular physical activity not only helps alleviate stress and anxiety, but also enhances mood and promotes better sleep, all of which contribute to reducing hypervigilant behaviors. By providing a constructive outlet for tension and increasing the production of endorphins, exercise supports a more balanced and relaxed state of mind. If you enjoyed this video, subscribe, like, share, and comment.